One of the most famous cases in the world is about Michael Jackson's plastic surgery.
Michael Jackson and plastic surgery. From lip reductions and cheek implants to eye reshaping and botched nose jobs.
He went for a nose job, but it became a pattern that he's done it again and again and again.
Yes.
There was no cartilage left in the nose.
Yeah.
Patients are forcing, emotionally pressurized to do the surgery, though there is no need for it.
When you come to celebrity crowd, for them body is an investment. Continuously revive their body. When I do a surgery on one part, that's compromised. That's no more a virgin area. The doctors are not aware where to stop. The doctor is compelled to feel guilty that I didn't do the good job and let me correct it.
Okay.
There'll be repeated surgeries before it. And that's where the body ends up in complications.
Nasal insert was put. So does it work like prosthetic nasal insert?
Yes. 3D mapping and then implant designing.
Gender affirming procedure. Even plastic surgeons perform this gender affirming procedure. Kleenex doing it, or some rackets which were bursted. And
person who's not happy with their gender that they're born in. See, if they're born a male, they want to be a female inside the mind. So they go for these translation surgeries in terms of their external genitalia. So there's just a change of your external organs, and then they're maintained for longer terms on some kind of hormones.
Going to have a permanent impact now?
Complication?
No, like whatever contouring
It's
is
a
done.
permanent surgery, yes.
Okay. Is it reversible?
Not all of them. So for them, it doesn't matter if it's a non-eligible person or an eligible person. Practice which is not under control.
Okay, unregulated.
Unregulated. Everybody is confused whom to believe, whom not to believe.
Recently, I was reading a report. This industry is almost about 9,000 crores.
There are many people who want uncontrolled practice than who really want controlled practice.
Dr. Deepthi Devarakonda, welcome to the Honest Hour.
Hi.
Let me bring up one famous case, ma'am. One of the most famous cases in the world is about Michael Jackson's plastic surgery. He went for a nose job.
Yes.
Right?
Yes.
But it became a pattern that he's done it again and again and again.
Yes.
Now here, like just a while ago, you were telling that the patient should be aware.
Yes.
Sometimes the patients are forcing. And later in some of the documentaries, it was told that the doctors were compelled or emotionally pressurized to do the surgery, though there is no need for it. Now, after his demise, there were news reports stating that he's almost lost his nose bone.
Yeah, septum. Yes.
Yeah. So after his demise, it was found out that there was no cartilage left in the nose.
Yes.
So how do we tackle these kind of situations?
See, first thing, most of the patients today are a little aware. Touch wood, it's very nice that they're able to come up with one important correction, and they know where to stop also.
Right.
There are some beautiful clients also today. But when you come to celebrity crowd, they definitely, for them, body is an investment. It's a big asset. And it's an investment for them. So for them, how much ever correction they do, there's somebody online or somebody offline pointing out to them that something else is wrong. So there's a constant inspiration to continuously revive their body. So medically, when I do a surgery on one part, that's compromised. That's no more a virgin area. And there's some more correction. And definitely I'm compromising it further.
Right.
So as you asked, how come the doctors are not aware where to stop? So what happens is, this is an emotional bond between the client and the doctor. Right. Somewhere at second surgery, third surgery, the doctor is compelled to feel guilty that I didn't do the good job and let me correct it.
Okay. So that becomes a vicious cycle.
So you see, all these people definitely must have gone to the top surgeons, no? Definitely. Then how come the top surgeons are doing this mistake? Right. It's a constant guilt trip for the doctor also, that the patient is not happy. Because this is not an essential surgery, and this can be done any times and to the satisfaction of the patient and the doctor. So this vicious circle should be somewhere drawn a line for. The doctor should be able to, at some point, maybe even I won't be able to, I'm telling you this, that they should be able to say, no, let's stop here, you're not fit for it anymore.
Right.
Most of the complications that you see, even in terms of any of the celebrity dying with a surgery or anything, there'll be repeated surgeries before it.
Right.
And that's where the body ends up in complications. If we are able to consciously take a decision and say no, then you can kill most of the complications.
So, like it was also told that nasal insert was put. So, does it work like prosthetic nasal insert?
Yes. Wherever there's a deficit body part, we have to rely on prostheses or implants.
Okay.
That's it.
So,
Simple.
would there be any breathing issues, etc.?
It's all designed as per our nose. All measurements are taken properly. It usually is placed in such a way that it doesn't compromise in your air space or airway or anything. Those kind of things are well monitored nowadays. So we have even computer-based 3D mapping and then implant designing.
Okay.
Yeah. So even for chin corrections, or you must have seen those nice jaws nowadays, the sharp jaws and all. These are all properly 3D mapped and corrected, and you can create an implant which suits you properly. So those usually won't go wrong in good hands, in well-equipped hands. That's not a problem at all. But don't try to get these surgeries done with quacks. There you can have many kind of issues because a wrongly placed implant would be very, difficult to readjust after that and all these things. It will disturb the virgin area. See, the first surgery, first hit is always the best hit. So try to get the best out of the first surgery.
Ma'am, another thing about Michael Jackson's case was its skin tone.
Yes.
Gradually transformed to so much of alabaster white.
Yes.
People started questioning whether he has vitiligo.
Yes.
So this is not just about skin tone. It also had some socio-cultural dimensions about racism, etc.
Yes.
Now, how can a person transform his color to such a great extent?
See, we have different medications, different kind of skin treatments and peels and all these things, wherein our melanin production can be reduced or reversed. So this melanin is the color pigment of the skin. So once you kill the melanin pigment, or it should be reduced in its production or increased in terms of its dispersal. So either ways you can achieve the color, the fairer color. There are multiple modalities for this. I can't just say one thing will do it. Multiple. It's a mixture of many things, internal and external.
Okay.
But nothing like removing old skin and putting new skin. This is something so many patients ask me, and I kind of feel how innocent they are. You can't do removing old skin and putting a new skin kind of surgery at all.
It's impossible.
It's impossible.
Do they scrape the skin or something?
Dermabrasion, that's again to just smoothen the skin, or remove some pigmentation. That's it. You can't just change the color of the skin with those kind of procedures. It's not advisable. Putting a new skin is only in a situation where the skin cover is lost because of any reason. Then we take a fresh skin from a normal area and then put it there. And always putting a new skin creates a scar.
Right.
It's not normal skin at all. It's a scarred tissue.
Okay.
Yes.
No, like not only Michael Jackson, especially in India, there's a craze for the white skin, So color, though there are huge campaigns like Nandita Das, etc., they've run campaigns like Black is Beautiful, etc. But still, whether it is in Andhra Pradesh and Telangana or different parts of the country, we see people are having that urge to go for a fair skin.
Yes.
So what is the solution for these kind of people? See, now, as a doctor, if some patient comes to you.
Yes. First thing is the not very desirable part on skin is pigmentation. See, you should not have pigmentation or uneven skin. Right. The best solution for a good looking skin is even toned, single colored, well maintained, moist, lustrous, supple skin. I was traveling in Tamil Nadu once, and in a remote village, I saw probably a 12-year-old girl. She was like this jet black, but it was so uniform. Her skin was glistening. She was just doing some household chores outside the house. She was so beautiful, you know. That look still blings in my eye. So how is she beautiful when she's like that black? She was really as black as the hair. But she was amazing.
True.
So it's not about the color that actually matters. But I'll tell you that you can come back to the shade that you're at least born with. No, you can't lose color because of your habits.
True.
Some things is in modern days, I can tell you that avoiding harsh sun for long time.
Tanning.
Yes. Keeping your diet very healthy, having all kinds of detox kind of schedules in your day-to-day life, and keeping your circadian rhythm healthy, your hormonal profile healthy, all these will take internal care of your skin.
Right.
Externally, skincare, I won't say go for 8-step protocol or 10-step protocol, but hydrate your skin the most. Skin behaves the best when you hydrate it properly. Even if you come to cuts and scars, no, a well hydrated skin will give the best scar.
Okay.
Yes, the best scar. So always keep your skin hydrated right from childhood. Just figure out what is working for you in terms of moisturizing the skin. Whatever is available in your place. I am not going to brand propose any product, but whatever, even sesame oil, ghee, whatever can moisturize your skin and whatever is working out for you, do it repeatedly. That's the best way, and have lot of fluids. Well hydrated skin has least pigmentation and the best looking shine.
Instead of telling all these things, people want shortcuts.
Yes.
Now, whom should they go to? Should they go to a dermatologist or a plastic surgeon?
Go to a dermatologist or a plastic surgeon.
I want a white skin.
Ideally, skin is dermatologist's job. I won't counter that. But there's no shortcut. The fact is there's no shortcut. Even if you go to your doctor and they give you some treatment, it'll work till the treatment is there, and then you will get back to your native color or pigmentation or whatever flaws you have, because there's no shortcut to it. And skin is a constant aging product.
Okay.
You have continuous aging process in your skin. So your skin treatment should be continuous. You do for 3 months and you stop and you expect that this will stay forever. No, because again the next day you're aging.
Right.
So your skin treatments or skin modalities should be continuous, whatever, whether you're following with a doctor or home or whatever it is. It's a maintenance, a long-term maintenance. This is something that you have to do all through your life. And one very simple hack to keep less concentration on the skin and just maintain itself is have your internal rhythm set.
Right.
That's it. You don't have to concentrate on your skin then.
Because people see celebrities like Bollywood celebrity Kajol or Bipasha Basu, or for that matter, in recent times Pooja Hegde, and they say that okay, they've done plastic surgery. Now see, they're transformed. They've become much fairer, etc.
It's not technically plastic surgery. It's more of products that can actually destabilize the melanin pigment and produce less melanin pigment and all these things. And you know, the kind of lifestyle that celebrities have nowadays, I'm really happy with it, because they take care of their internal rhythm more than the external. They're very good in terms of these diet managements and the activities that they're doing. Definitely their skin will show up, right? It doesn't have to be just skincare. They're doing a lot other than skincare, which we are not seeing. That discipline is great if we could do it.
Ma'am, recently, you must have heard about the celebrity called Kim Kardashian. There's also a famous show called Kardashians, The Kardashians.
Yes.
Now, it has almost created a global surgical crisis.
Yes.
Where the demand for
Plastic
BBL.
surgery. Yes. Just
Brazilian.
not BBL. Plastic surgery as such started tagging to Kim Kardashian. She talks about her surgeon. She talks about what implant she has and all these things. Yes, definitely.
And this Brazilian butt lift was one of the most famous.
She single-handedly promoted all of us.
all of these dimensions.
Yes.
Yes, ma'am. Yes. So what exactly is this, ma'am? What happens in this?
Brazilian butt lift is nothing but you desire for a well-rounded, lifted butt, because women always loves curvy body, you know, especially post 30s, 35s. They would love to have a curvy body. And as we are aging, the supportive ligaments for breast also sag, for butt also sag.
Okay.
So the butt also starts sagging. The upper pole of the breast looks very empty and all these things. So when we do a butt lift, we kind of fill the upper pole back with fat or either with surgery or whatever it is, that, you know, we can lift the butt up and put it in place. And it is in proportion with the rest of the body as a nice rounded curvy butt. So it's just one of the nice beautiful trends that's there.
But recently in 2025 she has mentioned that she went for reversal
Okay.
right?
Yes.
How does this reversal work, ma'am?
If you don't like the result in plastic surgery, most of the time you can reverse it. See, if fat was injected into it, you can get it removed again. So if once you get a surgery done, you're not happy with the result, you can plan for reversal in most of the cases. And these questions you have to ask in your consultation also. There are some surgeries where reversal can't be done. Say suppose I did tummy tuck. You can't reverse it.
Okay.
Yeah. Or we did a breast reduction. You can't reverse it. We placed an implant. Yes, we can.
Yeah, she also said that
yes.
she's reversed her implants.
Yes, we can reverse it. Now, there was a time when heavy breast implants were in trend.
Right.
Big breast implants and all. Now, people have understood the negative effects of heavy implants. Okay, that is also causing sagging and, it's thinning out the skin over the
Sherlyn
implant.
Chopra from Bollywood.
Yes, many people.
She's done the reversal.
Yeah, so there's new trend of coming down to smaller implants, more natural looking implants, and more aesthetically better manageable implants, and or people are even getting them removed in some cases after a certain age. So all this is possible with plastic surgery. Yes.
What is the average cost of these implants, ma'am? Breast implants?
Again, there are a bizarre variation in the costing. I know implants which even cost 5,000 per implant, and I know implants which even cost 60 to 70K per implant.
Okay.
So it depends on which quality you're picking. Ideally, I only pick the top quality because it is better to have the top quality, or else don't have it.
Okay.
That's it. So
what is the top quality? I mean, does it depend on the material? What kind of material is to
the
be
cover that it has? It's made of silicone. It should be thick, durable. It shouldn't react with your body tissues, create any reaction to your body, or it shouldn't get depleted because it reacted with your body.
Right.
So that is the most ideal cover. There are implants even for 5,000-6,000, which unfortunately are very high in the market in terms of in circulation, and these are which rupture, cause all this washed up surgeries and all these things. I have some clients who came from very low social backgrounds. There was a girl who was, I'm sure she must be 16 or something, not more than that. She was getting married, and her fiance told, I'll only get married if she has implants.
Oh my God.
And the parents bought her.
He wanted implants or a bigger
breast, probably. So her parents also gave into that and bought her. So I told her, why the hell are you even considering that case? Then you don't have to get married. No, but they were fixed for it. So the girl left because I kind of did a negative counseling.
Yes.
But I'll tell you what will happen in this case. Either they will go for a cheaper implant outside, which is very bad in the long term. In her case, I did tell her, if I'm going to do an implant surgery, I'm going to only pick the most best one.
Sure.
Let it be expensive. Otherwise, she's 16 or 17, in my opinion. Not because they told 19, but I don't think she's more than 16. So in the long term, she has to bear the implant for almost 40-50 years. So it has to be the best, or else I won't do it. That's it. I rejected the case. They were not able to afford that. So they are either going to go up to a place where they'll have cheaper implants, or they'll go to some quack who will give them medicines for improving the breast, which is not going to happen. And they'll give hormones, most likely.
Does it work, ma'am?
No. How will so estrogen can increase to a very mild extent, but not the desired cup size that they are looking for, not 1 to 2 cups.
Based on the food, based on the other things also?
It's genetics. Again, somewhere your hormones are not playing correctly, that the estrogen, amount of estrogen influence that should happen on the breast is not happening right. So these all factors come into play. If you know this old method wherein people
judge you.
Not judge you. There was this shastram. That where they assess you by your body parts. Health is assessed by your body parts. So there was a very old, still in Ayurveda also we can say, a woman with well-rounded breasts can give good babies. Why is that said? Because she has ideal amount of hormone production. So it's ideal for the correct development of the breast.
This is news to most of us actually.
Yes, it is very famous.
So like this case that you're telling, they've wronged on many fronts, not only about the breast implants and also like underage marriage also.
I know. They were telling me
planning
it was
to-
19, but I didn't feel she was 19 at all in any ways. I tried to downplay them, their thoughts and all a lot, but they were very sure. It was surprising that they were considering a boy who wanted this from the girl. At this stage, they can say no at this stage
Absolutely.
very happily.
Yeah, tomorrow he could come up with some other demand.
Yes. Especially, I tell this a lot to my clients, don't get it done for somebody else at all. Because definitely next day they'll have some other demand. And it's your body. It's not he who's bearing the pain and all. No, it's you. If you like it, please go ahead.
True.
Yes.
Ma'am, another thing, recently most of the youngsters have this fetish, when they see Deepika Padukone, they see the dimples, right? Tapsi Pannu,
Yes.
they see the dimples.
Yes.
And very recently, Pooja Hegde,
Yes.
dimples.
Yes.
So I've seen that there's plastic surgery for getting dimples also.
Yes.
How does it work like?
We just create a normal, very small pull in the muscle of your cheek.
Okay.
So when you smile, that creates a dimple. So these kind of small corrective surgeries are, in my opinion, very beautiful. They don't have great complications if they're done in the right hands. And if that's improving the dream of a person or fulfilling the dream of the person, then please,
No harm in it.
no harm at all. There are many beautiful procedures in plastic surgery which won't create any kind of long-term This thing called plastic surgery gives complications, not applies to many of the things in plastic surgery.
Okay.
They actually, if you're affordable, they really lift up the spirits of the person.
So when this dimple surgery is done, ma'am, is it permanent?
Yes. In most of
Okay.
the cases. And I'm telling if the technique is right, all this applies to if the technique is right.
Quote unquote.
Quote unquote, yes.
Now, when they do this dimple surgery, like even when they don't smile, do they get the dimples?
No, it's usually with movement.
It's with movement.
Yes.
Okay. It has to be done certainly in that way only.
Yes. That's
there's a,
what creates ideal dimple.
Yes.
Yes.
Now, there's another thing, like in the same context, when we talk about dimples, Botox,
Yes.
fillers,
Yes.
people say that when you take Botox, it is like your expressions become unnatural
Yes.
or you look frozen.
Yes.
Right, but there are some people like Lakshmi Manchu.
Yes.
She has embraced that. She has taken Botox.
Yes.
Right, and also very recently Janhvi Kapoor,
Yes.
Bollywood actress Janhvi Kapoor, she has transparently said what all procedures that she has undergone.
Yes.
And she's quite proud about it.
Yes.
Now the problem comes when people go through wrongful procedures.
Yes.
Yeah.
Yes,
So if you could
definitely.
shed some light on when we take these procedures, are they addictive? Number one.
Yes.
And how long do they last?
Yes.
And what are the side effects for this?
Botox is a drug actually which will paralyze your muscle for some days. It was actually a toxin which was initially a toxin produced by a bacteria, and we kind of extracted the toxin and made it in such a way that it paralyzes a part of one muscle, the muscle that you inject. So it exactly stays in your body for 6 months to 7 months depending on the person, and then it goes away from your system. That's it. It's not going to kill the muscle. It's not going to do anything. And this muscle can kind of, because it's so very relaxed, the wrinkles over the skin are erased.
Right.
That's it. Botox, in my opinion, is one very beautiful anti-aging drug. Very beautiful. Again, as I tell you, see, there is a drug available. It's not giving any long-term complications. You're affordable. You can visit the doctor every 6 months to take it. I don't see that as a threat.
Okay.
In my opinion. It's just for your general. See, it's like you buying a new sari. What's wrong in buying a sari every 6 months? That's it. It's not giving you any long-term complications. Again, in good hands. Okay.
That's what matters.
That I'll tell 100 times if needed.
Because these is in salons and clinics also, beauty parlors, they're giving these Botox
Yes.
shots.
So-
Also Botox parties that we are hearing about.
Yes. So always on the right hands, in the right setup, if it's not creating any long-term complication, I don't see that it's an addiction at all. Okay, coming to all these people embracing it, it's nice because today in movie industry they can't survive without all these perfections because everybody is looking so perfect. The cameras are HD, they so clearly emphasize every imperfection. So, and when these things are available, it's always I don't see any mistake in going there.
Right.
In getting those treatments. The problem comes when you're overdoing it.
Yeah.
So if you see some celebrities, I don't want to take any names, as you said, they have these mask kind of face. We are seeing it. That's when what happens is, if at all you came to me for Botox, I'll tell you, chalo, I'll do Botox, it will survive for 6 months. I expect you to see me back after 6 months.
Right.
But you come back to me after 2 months and say, doctor, I'm loving the result, but now the result is waning and you give me the Botox right now. I should say no. Even if I say no, you won't listen to me first thing. Or you'll see another doctor and get it done there. That's overloading it.
Yeah. That's where the problem comes.
So in aesthetics at least, please listen to your doctor blindly. At least if that's a qualified doctor, listen to them blindly. Because when they say maintain the distance or gap, please maintain it. If not this, you're going to another doctor. So that's overdoing it. Those kind of mistakes are not to be done. You have to know how to play the aesthetics very well. Aesthetics is absolute art.
Right.
Absolute. The artist should know what they're doing it, and the canvas also should know how to get it done.
That sums up most of the issues.
Yes.
Yeah. So like Malaika Arora Khan, I think she's above 50, right? Now, whenever she posts some photo or video, the internet people, especially on social media, there's a debate. No, I think she's undergone surgery. No, I think that it's a dedication. It's her hard work. She's into, wellness. She's into good lifestyle, yoga, exercise, etc.
Yes.
Now, recently, Neena Gupta, she mentioned that in Bollywood, aging is seen as a curse, right?
Yes.
So, what is this phenomena, like, our obsession of anti-aging?
Yes.
How far is it, genuine to consider anti-aging procedures, and where should you draw the line?
First of all, aging is a continuous process. And if at all you're aging early, say suppose you're looking old by 30, 35, then once reconsider your internal system.
Right.
Something is not right inside. You're aging faster. So the thing that you told, Malaika Arora's case, I love the discipline that she shows.
Right.
Because anti-aging, even with procedures, will not come to that extent if you're not disciplined.
I think that is a takeaway people should understand. Even if you go through the best of the procedures, you have the best of the money with you.
You can't create that look at her age if she's not disciplined.
Because some people think I have the money, so I'll get the best procedures.
Yes.
I cannot follow proper,
I
lifestyle,
won't follow any
etc.
diet. Yes.
I need to party. I need to,
all my schedules.
Yes.
So that won't happen. Even with maximum money or maximum procedures also, if your lifestyle is not up to the mark and at that age, that kind of look is impossible.
Right.
So that discipline is mandatory if you want to have anti-aging procedures. First of all kinds of, at least post 30, you have to be sorted in terms of your lifestyle to start aging slowly. Yeah, to reduce the speed of aging. And then you get some enhancements with aging procedures, anti-aging procedures, and it'll amazingly do well. And the person who's doing that kind of discipline has the consciousness to say no when it's required. Most of the time.
Right.
That's it. They don't overdo it.
But many of the middle class are also undergoing an emotional turmoil, when it comes to aging.
Yes.
And sometimes people also in their late 40s or early 40s, they become intolerant of aging.
Yes.
Right? They start hating themselves.
Yes.
We see mid-aged people.
Yes.
So for them, what are the procedures that you would recommend? These are the basic things if you do, I think, at least for your emotional well-being, it would be...
So here in your question, I want to refine and ask, what do you mean by anti-aging? Is it just skin or everything, every body
People
part?
want everything these days. Earlier it was only skin.
Yes.
Now they're
then
considering
when it's
all aspects.
everything, how do just 1 or 2 treatments on skin create anti-aging?
Right.
How? No, everything. It's impossible. So you have to work it from inside. Proper discipline, proper sleep,
Right.
good diet, warm diet every day, nice, well-cooked meals, balanced diet, and healthy mind and healthy relations. Enough, too much of socializing is happening nowadays. I don't know why that is so important. So, this all kind of create mental turmoil. You want to keep up to other people's standards rather than your own standards. Keep all this in place, settle them down, have a little balanced life, and then you'll automatically age slower and reflect on your face. When you had a good night's sleep, next day your skin looks amazing. It's simple logic. That's it. If you sleep every day, then your skin will definitely look amazing. What else do you want? So this kind of discipline is mandatory. And coming to procedures, at least post 40, I would say start skincare somewhere post 30 itself, because your skin starts aging from then on.
Right.
And if you do skincare between 30 to 40, you can delay the aging for around 10 years.
Okay.
So initially, as I told you, importantly, hydration. And if you're going into too much of harsh sun, then sunscreens are the key. If you're using makeup products, use mineral-based makeup products. Don't go for too much of chemical-based makeup products, and keep the skin fresh after the makeup, remove it properly and all these things. These are enough at that age.
Right.
Botox. Go to Botox absolutely when you are about to see your first wrinkle, not the permanent line. See, there are two types. The ones which are permanently on your face even when you're not moving.
Right.
The ones that you develop when you're talking. So the line that appears when you're talking, if it's staying there for a little more than required time, that is the time then you have to go for Botox. You don't have to run to Botox at 20s. I see many people are taking Botox nowadays in their 20s. It's absolutely not needed. You can go to take Botox when you start seeing your first not static line, I'll say, the line which is staying a little longer than required.
Right.
Yes, your skin can feel that there's a line that's about to come.
Yes.
That's enough. That's when you can start Botox. And that is one of the first anti-aging and the lovely anti-aging technique.
Okay.
Fillers is rampantly pushed into the market. It's a very revenue generating product for the vendor also. But again, be cautious here. There are many studies that say that fillers retain some product into the face.
Okay.
After some years. Overfilling happens eventually. So unless you feel that a filler can really get a good change in your face, don't go for a filler. Avoid it.
Okay.
Unless you see too much of hollowing and too much of loss in your facial volume, I say avoid a filler. Because it's not very mandatory in anti-aging. Filler is too pushed about in market nowadays.
Right.
Yes. And weight. One massive trend that I'm seeing is losing weight massively.
Yeah.
They're trying to look too skinny. If you're looking skinny, your face also loses fat. It's a byproduct.
Yeah.
Thinner faces age faster. So the thinner, the less is your facial fat volume, you look older. Always. So at least after 40 years, reach your ideal weight by 40 years. After 40, avoid any massive weight loss programs. Once you start doing weight loss after 40, your face starts losing fat, and then that's where you start wrinkling and look very old. I'm seeing many people are doing this mistake of losing massive weights after 40, and it's absolutely a big no.
And also we see this excessive use of Ozempic. Right?
Yes, after certain age is a big no. Okay.
Right.
And yes, if at all your weight loss is giving you better benefits in your health than your aesthetics in mind, please go ahead, because it does give you.
When they do it excessively, as you said, loosening of the skin happens. And all that.
But in some cases, suppose they are somewhere around 90 or 95 or 100. Above that, I suggest bariatric only. So if at all they're at that weight, definitely that's going to cause other problems for them. So chuck the facial aesthetics and go for Ozempic in case you have to. Because that amount of weight loss at that parameter definitely helps you in your body reformation.
Right.
And Ozempic, in case you're taking any, or Mounjaro or any of these products that you're taking, don't go for rapid weight losses. I see that people are escalating their doses very high, very fast, and they're trying to lose weight very fast. See, when you lose so much of weight suddenly, body thinks that there is some metabolic or some issue in the body, and it only preserves the vital functions and sheds everything else. One of it is hair.
Right.
And face ka look. So try to lose weight over a period of time. If at all you're going for these drugs, they should be planned over 2 to 3 years, not in just 1 month or 2 months. Do a slow weaning off, and then that's where your facial look is preserved. Once you lose it, once the facial fat volume is lost, it is difficult to get back that kind of look.
Right. Ozempic or Mounjaro, which one would you suggest?
Mounjaro.
Why, ma'am?
It has a better combination of the GLP hormones, and you lose weight faster. You have lesser GI disturbances in terms of nausea or diarrhea with Mounjaro. It's a simple adaptability to the drug, which is more with Mounjaro.
These days, people are taking it OTC also, right? Over the counter.
Yes.
So these drugs, should they be taken under medical supervision
yes,
only?
Absolutely. Because when you're losing weight and you're having these drugs, you're definitely losing many nutrients from the body, because body can't really differentiate what is it losing, fat or anything. A whole nutrient loss is done. So you have to be periodically monitored for your iron, your vitamins, your proteins and everything, and see as a process of losing fat, you shouldn't become bald, or you shouldn't suddenly become like an old person. So you have to preserve your facial volume, and you have to preserve your hair. At least in coming to aesthetics. And your skin should not suddenly sag. So there is a very monitored or structured way that we have to apply to, so that the weight is lost without losing all these benefits. Yes, it is strictly to be done under supervision. In case they're not doing under supervision, they're at their own loss. Nothing happens.
But there are many cases reported when it comes to liposuction and bariatric surgery, which have gone, people have lost their lives.
Yes.
So can you spread some awareness on, liposuction, and how does it work? Like, what should be the patient more cautious about?
Yes. Coming to lipo, the first and foremost thing is liposuction is done by plastic surgeons. Bariatric, yes.
Okay.
Bariatric surgery is not a part of plastic surgery at all. It's a part of surgical gastroenterology, and gastroenterologists do it, not us. So I'm not talking about bariatric here. Coming to plastic surgeon, always get it done with a trained plastic surgeon, because in liposuction, see, if this is the skin, this is the fat, and these are the vital organs. You have fat exactly under the skin. So in liposuction, we pass a long cannula with holes in it, so that it exactly goes into the fat zone, and then a vacuum suction is attached to it, and we suck out this fat through that pipe.
Okay.
So the expertise lies in putting this cannula exactly in the fat zone. See, fat zone is around, say, probably 2 inches or 3 inches. So if the person who is doing it doesn't know where is the fat zone, if he goes a little deeper is where the complication comes. So imagine how precise it is. So the person that's doing the surgery should be very well trained to know what is the fat plane. Whatever you must have heard, these on-table deaths and complications usually come when they go into the wrong planes, and generally done by inexperienced people.
True.
So that is very important in lipo. Other than that, it's a beautiful surgery in terms of contouring. Again, liposuction is not for fat loss weight loss at all.
Okay.
If you are aiming to lose 20 kgs, then liposuction is not your surgery. People come and ask me for lipo, and at the end of the consultation, they'll say, how many kgs will I lose? You won't lose. Liposuction is for contouring. After you have lost n number of kgs, and you feel one part is not listening to you. Say, suppose you took Mounjaro and for around 1 year, and only your arm fat is not going. Then that is where you come to a surgeon for liposuction, because that fat is not listening to Mounjaro, and it needs to be removed surgically. So liposuction is absolutely a contouring surgery and not a weight loss procedure at all.
But I've heard other term called gastric belt, tummy tucking.
Yes.
Is that also done?
Gastric belting, that is again bariatric surgery. That's
Okay,
a completely different.
Okay.
Yeah, that's for weight loss.
Acha,
That will reduce your appetite and reduce the amount of food that you eat. So that will directly cause fat loss metabolically.
Right.
Tummy tuck is again our endeavor wherein we do this. Tummy tuck is again contouring, right?
Okay.
So the belly fat and the loosened muscles are tightened and we give a very flat tummy. So the tummy becomes flat. It's a contouring surgery. Contouring again comes under plastic surgery.
Acha.
Yes.
Ma'am, having understood that, there is another trend these days.
Yes.
People are hitting the gym. People
Yes.
want to look healthy.
Yes.
People want to have a good body posture.
Yes.
That is good.
Yes.
But some people want it as quick as possible. They want six-pack within, let's say, 3 months.
Yes.
Or sometimes even a month they want six-pack.
Yes. Yes.
And I've seen that there's something called as ab etching.
Yes. Yes.
Right? How does it work? Like?
Again, ab etching. See, this is not an alternative to a big pot belly, and you go to the surgeon and you get a six-pack immediately. Even for ab etching, you have to come to a kind of a normal tummy.
Right.
Again, that's about working out, losing fat, or some other, maintaining your diet and everything. So, if you come kind of at least a normal tummy, then the etching works in wherein we design the fat that's there in your tummy into nice muscular lines.
Okay.
Yeah. So, why do we see six-pack abs on a tummy when there's light falling on the tummy? The depressions are the areas which are dark in color, and the highlights are the area which is bright in color. That's contouring again.
Right.
So, with fat, we give those kind of contour lines. So, the light that falls on the abs is again having these dips and highlights, and it looks beautifully. This is called etching. These are all called high definition liposuction. So we kind of design the grooves and the highlights that we want in any part of the body. We can even do deltoid designing. Okay. Yeah, and we can give contours on the face with highlights on the cheek and all these things. So this is all done with different procedures. This contour and highlighting is a part of plastic surgery.
But these days we see even most of the males.
Yes.
They want enhancements or improvement in the way they look, whether it is their body or their face.
Yes.
Right. Now people come up to you and say, like, I want that dip in my chin like Brad Pitt. I want a jawline like Hrithik Roshan.
Yes. This jaw thing is so in nowadays.
Yeah. Can you tell about any specific cases or peculiar cases that come across
most
from,
of the
the male side?
They all want a very fine, strong jawline. That is
fine and strong.
Strong jawline.
The bone should be visible.
Yeah, the bone should be very visible. There are many people who have very small double chin. They'll be like, ma'am, remove this. Yeah. I tell them, no, your double chin is absolutely fine for your face. The small chin bulge.
No, why do some people have double chin?
It's genetic most of the time. See, not just double chin. Anywhere if your body is accumulating more fat than the other parts of the body, it's usually the genetic attraction to that area. Fat deposits more in that area genetically. We can't really do much about it. And so the biggest solution for this is liposuction. We remove the fat cells from there completely. So there's no further deposition. So that's how liposuction actually helps in this irregular deposition. Liposuction doesn't do weight loss. That just helps in this irregular deposition. Coming to jaw, there are multiple procedures we can do to enhance the jaw. We can right from non-invasive or minimally invasive also. There are fillers we can do to make the jaw prominent. If you go further, we can do bony corrections to make the jaw prominent.
How is a bone correction?
We kind of create a surgical fracture again in the bone and make it, fix it at a distance wherein it creates a very nice, strong jaw and bone deposits in between wherever we have created.
Doesn't it change the structure of
Yes, definitely. There are many celebrities who get it done very, very frequently.
It has to be done frequently?
No. Very commonly, I mean. Yeah. So,
does it have any side effects?
See, plastic surgery specifically done in the right hands with the right technique usually will not have long-term complications. See, if I'm a plastic surgeon or if it's a plastic surgery, that itself means that I'm trying to give you normalcy. If I disturb your normal function, then I'm not doing a plastic surgery. So most of the plastic surgeries designed correctly will not end up in long-term corrections or complications.
So jawline is one thing.
Yes.
And six-pack abs. Apart from this, what are the other things that
Males
patients
want
come up with?
lipo is one of the and the major thing is hair transplant.
Yeah. I'm coming to hair transplant. Just a while ago, also with excessive weight loss, there is also loss of hair. Now, when there is a hair loss, or some people are undergoing early balding.
Yes.
Like in early 20s also you see people losing their hairline, etc. Now for hair loss, whom should they go to? Should they go to a dermatologist or a plastic surgeon? Does plastic surgeon treat hair loss or hair transplant?
Yes, we do. We do hair treatments. We take care of the hair. But in case you're not able to reach a plastic surgeon, for general maintenance, it's very good if you could reach a dermatologist who's well versed in trichology and all. And after that, for hair transplants, nowadays it's legally approved that only dermats and plastic surgeons can do hair transplants. Coming to what is a hair transplant exactly? It's a hair follicle with a set of skin around it, the circular skin around it. So what is grafting? I'm taking this whole unit, the follicle with the surrounding skin, taking it to another area where I'm transplanting it, creating a hole there, keeping this unit, filling that space. So this skin has to stick to the recipient skin and keep the follicle there.
Okay.
So this is exactly a very micro level skin graft. So skin grafting is an amazing technology, grafting, which is specially trained to the plastic surgeons.
True that.
So these people are very good in terms of the logic behind the transplant. So in case you can get it done with a plastic surgeon, I'll say please, that's the best.
But we see a lot of people going to Turkey for hair transplants, some people going to Bangkok for hair transplants.
Yes.
So have you seen any peculiar cases that people come back after those transplants and they see some kind of major side effects?
Side effects, the biggest, the complication that can happen with hair transplant, if it's done in I should say unhygienic setup, it can lead to cellulitis of the scalp, and then it can cause sepsis and death.
Oh my God.
Yes.
Sepsis also.
Yes. That's because hair has so much of vascular supply. Head has so much of vascular supply. So the most important care that you need to take is which kind of setup are you going for? It should be absolutely aseptic, a nice OT setup and all these things. Why Turkey, Bangkok and all is the government there is very, very interested in promoting health tourism.
Right.
So there are many kind of, methods for the doctors there to get the patients right from airport. They have these legal proceedings very tight and everything is monitored there. There's a whole ecosystem for it. India somehow didn't get into that market yet. Probably in the future, we will have this kind of support from the government. In case that comes, India will become one of the biggest hub for these kind of procedures because we do at a much cheaper price than many of the countries.
Okay.
Medical expense costing in India is much cheaper when compared to all these countries. So it is very easy to attract international clientele in regards to our pricing and our techniques. Indian doctors and surgeons, I can vouch and tell you, are one of the very best in their technique because they get a lot of hands-on training in their education days.
Yes. But why do still people go to Turkey and etc., ma'am? Indians go there, right? I think it is lack of awareness or something.
Yes, and probably, that international tag, the factor. And definitely there could be some centers which are doing it for lesser price. But we still get lesser price in India. I really, you should ask them.
So this hair transplant, ma'am, like once we do the hair transplant, is it permanent?
See, if you have lost hair there, that means that some process is making you lose hair. Okay. We install new hair.
Right.
That is growing. So this process of losing hair is continuous. So this new hair is also subject to those influences. So in case you are a genetic case, you have a traditional balding pattern, you lose the hair that is installed again.
Right.
But it will take some time. So you can get the next transplant after some years. So the process of losing hair though is continuous.
Okay.
Whether it's implanted or whether it's your natural hair.
Now, like a youngster, like in their early 30s,
Yes.
right? For them, what is the red flag that they need to visit a doctor when it comes to hair loss?
You'll start seeing body patches slowly, excessive thinning of hair, and especially in the forehead line, if your line is receding faster. I will say visit the doctor in the initial days of hair loss only. Don't wait for a longer time, because if you can save your hair in the initial days with identifying what are the factors which is causing the hair loss, which with some supplements and some treatments which you can do to protect the hair, then definitely that will help you to prevent delay the balding for a longer time. So if you're seeing alarming amount of hair, loss of hair in the recent days, please go to the doctor. Don't wait for it to affect the affect the hairline. You shouldn't wait for that time that the hairline gets affected. As soon as you see that your hair is falling more than required, and there is no illness or any other factor which is contributing to the hairline, please go in today's days.
Ma'am, like one of the less discussed topic is this gender affirming procedures.
Yes.
As plastic surgeons, like when I was going through, I read that even plastic surgeons perform this gender affirming procedures.
Plastic surgeons only perform.
Okay. But sometimes in the news I've seen some clinics doing it, or some salons doing it.
Salons also.
Yeah.
Okay.
So there was some rackets which were bursted.
Okay.
So what exactly is done in this, ma'am?
Gender reaffirmation is nothing but, a person who's not happy with their gender that they're born in, they're mentally on another level in terms of the gender. See, if they're born a male, they want to be a female inside the mind. So they go for these transformation surgeries in terms of their external genitalia. If it's a male, they go for penile-ectomy. The penis is removed and they kind of create it into a vagina. And if it's a female, the opposite is done. And in case of male, there's a breast that's given to them to convert into a female. And in a female, the women loses the breast to be a male. So there's just change of your external organs, and then they're maintained for longer terms on some kind of hormones. If it's a male to female, they're put on female hormones, and if it's a female to male, they are put on male hormones. This is the actual mechanism that goes in gender reaffirmation. Apart from this, nowadays, to enhance the look of a female on a male, you have these facial feminization surgeries and all these things.
How is that done, ma'am?
We see, for males, there's specific characters. What's the difference between a male and a female face? Males have wider jaw, more masculine jaw, more prominent eyebrows, the forehead is more prominent, the malar eminence is less prominent, and all these things. In a female, it's the opposite. So we kind of, reduce the bone size, improve the fat content here, remove the prominence of the eyebrows, kind of chip the bone there, and all these things to, kind of soften the forehead and all these things to give a feminine look to the male face. You can almost make them look like a beautiful female.
So when you do that, is it like going to have a permanent impact, ma'am?
Complication?
No, like whatever contouring
it's
is
a
done.
permanent surgery, yes.
Okay.
Yeah, most of the cases it's a permanent.
Is it reversible?
Not all of them, very few. Mostly I'll say no. Once you chip off the bone, there's no the bone won't grow back, right? Again, you have to, if you want a male face, again, probably you have to give in fillers and make it again prominent. Yes.
Okay. I've also seen this, like, especially in Southeast Asian countries, and specifically Thailand, Bangkok, etc. You have this something called lady boys. What is that, ma'am?
It's just a woman with a male genitalia. So through surgery or some penile implants or something, she gets a male genitalia. It is just a kind of sexual adventure. There's no biological male in the person. It's just a kind of new adventure, that's it. Yeah.
Can this, like, people undergoing these surgeries, like gender reaffirming or gender affirming surgeries, can they give birth to children?
No. See, their internal organs are their own, the organs that they're born with. So if a male is born, he's born with testes. And as a process of gender reaffirmation, they remove the testes, and that's it. They don't have any ways that they can produce an egg or a testis later, right? So they can't have their biological kids. They definitely can't give birth to a baby by themselves. No, it doesn't happen. This is absolutely not transfer of genetic material at all.
Doctor, when I was researching about plastic surgery and plastic surgeons, so many of the cases were related to celebrities or any prominent people or people who are affluent,
Yes.
or the richer sections of the society, or celebrities per se, in the movie biz, etc. So when people come up to you with demands of implants, fillers, Botox, etc., what is the cross section of people that come to? It's only these rich people, so-called rich people. There's nothing like rich or poor, but so-called rich people, or how does it work like?
No, plastic surgery is no more class-based thing at all nowadays, because there's so much of social media, there's so much of expectation standards, physical body standards that are set up now. Everywhere, even maid gets to see what an influencer says, right? No, in terms of the body parameters and all. So I have seen that in my practice recently, at least post-COVID, that there is no class difference.
Okay.
Even for especially breast augmentation is one of the most frequently done procedures nowadays, and most easily wanted by everybody. We have seen people, who are housemaids, daily laborers, grade 4 jobs, whatever it is, that who have even there was a maid once who literally to buy the implant, she had to keep her jewelry for so
she took a loan, like pledging her jewelry. She came for a breast implant.
Yes.
And what was her reason for that, ma'am? Why did she want an implant so desperately?
Most of the cases,
when she was ready to pay interest amount, take the risk of a loan.
Yes. In these groups, mostly it's somebody else triggering them to take the surgery, because they constantly taunt them saying, you're not fit, I'm going to go somewhere else, it's their husband or partner, whatever it is. So they're constantly degrading them morally, that by hook or crook they want to retain their husband. By hook or crook. And that guy, even after the surgery, wouldn't even look them, because he's already mentally prepared to go with somebody else. It's just a procedure to get rid of them. But these people don't understand that. They want to do it by whatever method it is, and then they won't retain also. That's a different story. But that is the extent which pushes them to get these surgeries done.
They are so desperate to even try all means to retain the marriage.
Whatever it is. And one more group that I'm seeing is young girls without proper awareness. They think that, to meet the peer pressure, to meet the standards of a group or something.
Many times because of body shaming also.
Yes.
People say you're like a stick.
Body shaming is happening, at the level of 10th grade or 9th grade on public platforms by their own classmates.
Exactly.
It's very common nowadays.
There's some videos saying that your body looks like a male.
I know. I don't know why there's a discussion about body at that age, when that's the right age to turn towards career goals and all these things. So there's so much of social standards that are set nowadays with social media, that everybody is influenced, we can't prevent or protect anybody in this. So these young girls, right from 15, 16, they want to do something to revive their body so that they fit into or be the best in the group.
At 15 years, they want a
15 years, they are discussing a lot in the class. So we generally, I personally generally push.
What is the minimum age, ma'am, to take up implants?
There's no minimum age as such, but I generally personally push it to post 18. And at that age group, even if it's 18, till they're not like a proper adult or woman or anything, I insist on having parents around. And one more
So many times they come without the parent?
Most of the time. They say, I'm in a hostel, I want to get it done with my friends and all these things. We kind of very bluntly discourage them. And they save up money for the procedure. Imagine.
So they come in a group?
No. They come alone most of the time, or with their boyfriends or so. And they save up money for it. Most of the time.
So many times even because of the boyfriend, pressurizing them, or
that's a huge factor.
Liking of the other
that he might like somebody else. That's one huge factor, which is not a very healthy situation. I think we all should very strongly train our girls to tell them that your body can't be judged by anybody else. Come whatever it is. As far as you're healthy. That's all. That only matters. And one important thing while taking up for their surgeries is having a consent from an adult, at least till 25. That's very important. And one change that I'm seeing in the ecosystem is nowadays parents are willing for this. There was a time when it was a big taboo for the parents.
Right.
If the parent is also willing, and if the girl is also willing, probably that's a different story. But again, here, don't get it done because the fiancé asked, or somebody asked. That's not worth it. He's just not looking at the girl. His intention is not the girl there.
True. Also, like I was reading in one of the newspaper, the Hindu newspaper, one particular case. It was mentioning that when there are rising divorce rates, it is also giving some correlation with plastic surgery.
Definitely, no. See, when there is a divorce, they want to move forward. They want to definitely get the best partner this time. So they want to make themselves look best.
Okay.
It's a simple equation there. So once they had kids, or even if they don't have kids, there are definite body changes as we are aging. So they want to revive a complete transformation, have a complete transformation to their pre-pregnancy state, so that this time they have this hope of getting a better partner. That's and we are seeing this, when they're moving on, most of the people come for plastic surgeries at that stage. And that's a very common trend, and as divorce rates are increasing, this in-between marriage transition plastic surgeries also are increasing a lot.
One of the most traumatic things are the burn victims.
Yes.
Burn victims and acid attack victims. They suffer tremendously.
Yes.
It is not just momentary suffering, but throughout their life.
Yes.
It is tremendous emotional as well as physical trauma that they undergo. Any peculiar case or any specific case that you can share with our audience?
I won't say anything particular in terms of medical terms, but in burns wards that we have worked, we generally see that most of the time there will be homicidal burns. Either the mother-in-law, the husband, they create a situation where the burn happens and the lady is at risk. So, but the sad reality of our ecosystem is that after coming to the hospital also, the lady will always say, it's me who did the suicide. Why? Because she doesn't want her husband to go to the jail thinking he will take care of the kids.
You see such cases also.
They're very common, very common. We try to explain it to them, the guy who's not taking care of you will never take care of your kids. Definitely.
Absolutely.
So most of the time, the dying declaration was given in the favor of her suicide only. So there was a lady once in my ward, and I literally sat with her for 2 days, taunted her, ki, how can you say it's a suicide when it's evident that, he did this situation. Then one proud moment is I could make her do a redo dying declaration, wherein she got the courage after 2 days. She called the police in charge or something, and then she gave a statement saying her husband only did it.
Okay.
That was one, at least, for me, a change, creating a change moment. So most of the time, burns are usually not very desirable scenarios in Indian ecosystem.
Ma'am, you're in a demanding surgery field, right? And more importantly, plastic surgery.
Yes.
Now, you must have also worked in some corporates.
Yes.
So is there any specific case, some of the cases that you remember,
Yes.
where you questioned your very identity as a surgeon?
I won't say identity, but the placement of a surgeon in corporate industry. Yes, definitely. Just not surgeon. See, any doctor in the corporate industry is expected to yield the maximum benefits for the corporate industry. Definitely when it's commercials, when it's about finances, your ethical thinking somewhere has to be a little compromised.
Okay.
In whatever, like for example,
How much little is that little?
Most of the time, I believe that, very strongly believe that the doctors stand for their ethics. There's no way that they will deviate from it. But there'll be problems in terms of counseling the patients or telling them realistic. See, the hook or crook thing is to convert the patient, definitely.
Right.
So in that process, they might not give a wrong surgery, or they might not give an absolutely new surgery at that point, but the way they take them to the surgery, in the sense, the mental preparation may be different. See, in my case at least, in one of the corporates that I worked, there was a case of a complete cut, hand cut, and that person was a lawyer actually.
Okay.
So for him, writing is a very important thing. So I was kind of telling him, see, I will repair all the things, but the complete movement of the hand sometimes can be compromised. I can probably confidently say it is around 50%, because he came to me after almost 2 days of the injury.
Okay.
Yeah. So, but behind my back, without me knowing, there was another person called the conversion agent who went to the patient and told him that no, ma'am is just telling like that. You will have 100% recovery.
So this conversion agent's work is to convert the patient.
Yeah, they're financial counselors or whatever it is. The person that tells you the price tag in all the hospitals. So it was foolish of the patient also to believe his words, but he got somewhere carried away saying that, he's telling 100% conversion and she's telling 50 or 60%. Let me believe. It's always nicer to believe the easy fact. So these kind of misinformations, when it's when they're being taken up for a treatment, is common, just to make them more comfortable for the procedure. So somewhere the patient, I feel, gets lost in the realistic expectations, and they expect something out of the surgery, and these kind of the things will create issues in practice, in corporates generally. That's why they're always unhappy with the corporates, because after the treatment they feel that they didn't get what they wanted.
True.
Yeah. So these kind of things will place the doctor in a very uncomfortable position, because later the doctor is more answerable rather than the corporate management.
Another thing, like usually in medical industry, when we talk about doctors, one is the clinics and hospitals. And other important people that you see near any doctor are the MRs or the medical reps. So how does this ecosystem work in your industry, like plastic surgery industry?
See, plastic surgery basically doesn't rely on many medical equipment, I should say drugs or anything, because we are mainly surgical department, and the entire forte of the department is our skill, and probably my one scalpel and my needle holder, that's it. But when it comes to aesthetic industry, I should say, there are a lot of products that many companies want to push into the market, definitely, because aesthetic is such a demanding industry in terms of creams, in terms of different types of implants, different types of products that you inject, fillers and all and everything. So every company wants to push its product. So for them, more the practitioners, more is the product push. So if we take the right amount of eligible practitioners, that's a little less, definitely. So for them, it doesn't matter if it's a non-eligible person or an eligible person. So somewhere they also have a personal interest to increase, I won't say quackery directly, but probably practice which is not under control.
Okay, unregulated.
Unregulated. So that is where things are going a little haywire in aesthetic industry, because you see so many clinics, so many doctors. No, everybody is confused whom to believe, whom not to believe. Sometimes even we are alarmed when we listen to some doctors in some other state, the kind of surgeries they perform. We're like, seriously, he did all these and I have to go back to the internet and search for his degrees. He will have more number of degrees than a real plastic surgeon. So it is a little worrisome in this ecosystem. There are many people who want uncontrolled practice than who really want controlled practice.
Right.
Yes.
So recently I was reading a report. This industry is almost about 9,000 crores and fourth largest in the world in India.
In India.
Right. Having said that, there's also, as you said, a lot of quackery, a lot of fake clinics.
Yes.
So as a patient with genuine concern, it becomes very difficult. Just a while ago, I was reading one patient from Kerala, a 31-year-old, Mrs. Neetu. She went to the clinic for fat loss surgery. And she ended up getting all kinds of complications where she had to lose her life.
I know.
So in this case, what should be the patient awareness that you'd like to?
The first and foremost thing is, in case you want a surgery, search for a surgeon, especially aesthetic surgery. Search for a plastic surgeon who is also doing cosmetic surgery. Okay, how do I know if it's a plastic surgeon? I've told this in many of my interviews and wherever it's possible, that a person who's a plastic surgeon will directly have an MCH degree.
Okay.
Especially in Indian standards, MCH, the word matters a lot.
Okay.
If they are not an MCH, is where all the other words will come. Cosmetic surgeon, trained in UK, trained in US, everything comes when this is not there, then don't go there.
Right.
Because the person who's not the right MCH will have n number of degrees except for that word. You can't put it on internet because it's illegal. You have to have the degree. First qualification is MCH, then comes the practice in cosmetic surgery. Again, just an MCH without cosmetic practice can be a problem for the patient. So cosmetic surgery. So see what all they have done in terms of cosmetic surgery. See what all practice they are regularly doing. See, suppose you have gone to a doctor who's practicing trauma regularly and you go to them for liposuction. They might not give life complications, but definitely the result might matter because they're not doing it on a day-to-day basis.
Right.
And it's not illegal also. They can do. So, but your result might be compromised. So these kind of researches are very important. And then last, go and meet the doctor, whether it's online or offline or something. Don't listen to some mediator in between. Unless you talk to the doctor directly, don't go for surgery. If possible, meet them 2-3 times. Don't think about the consultation fee. Please meet them 2-3 times because it will end up in long-term safety. And these 2-3 times, definitely talk to doctor as much as possible. I've seen some beautiful clients who come to me with a nice list of questionnaires. They prepare for the procedure. They have this complete questionnaire and they come and get it sorted and then go for surgery. I love those kind of clients.
Right.
They're very aware of what they're getting it done and they are prepared for the post-op. Everything, they are very easy to deal with. Some people randomly come, they don't understand what I'm trying to say. They'll say, I'll go for surgery. I kind of get intimidated to do those surgeries because I know they're not prepared for post-op. So if it's a surgery, yes, it's a big decision. Please take it consciously. Do the homework. Last thing that I say is, in that surgery, don't do excessive Google research because Google always makes or allows content which people would like to see. So it has to create content for people to see. So either it's good content or bad content, internet is not bothered.
Right.
So you can come across bad content also. So definitely only go to some major websites which are medically recognized or something.
Right.
Do a minimal research because you should know what you're going for and stop it there. Don't go to all kind of influencer sites and
Instead
everything.
of doing that, they're going to Instagram.
Yes.
They're going to Snapchat.
Yeah, and this is not valid information. This is not valid information at all. And then meet the doctor. After your research, if possible, go and meet the doctor again. And if you have some fresh doubts, ask them. Be completely clear before going to the surgery and then go for the surgery. That's the most conscious decision that you can take.
Ma'am, you've done your medicine from Gandhi Medical College, one of the prominent colleges, located in Secunderabad.
It's a tertiary care center. Yeah.
So you must have come across plethora of cases.
Yes.
Right. Now, these days there is a new trend that people are opting for private medical colleges.
Yes.
But you were insistent on going to government medical college. Can you share your experiences of Gandhi Medical College?
See, it's just not Gandhi, probably any government college. The best part, at least in my college, is the tertiary care center setup. So all the non-treatable cases which are, which can't be treated in secondary setups and everything, all the complicated, all the very different kind of setup cases used to come to Gandhi. So the kind of exposure that we got was amazing, really amazing. I can tell you, I must have seen such rarest of the rarest cases. There was, many, pediatric congenital anomalies. There were rare congenital anomalies that I have seen. There was a kid with almost, this kind of staggered tightening. Here one tightening, here one tightening, here one tightening, and here one tightening. And the remaining tissue was normal. So there was very very rare kind of limb abnormalities.
So for such case,
we just release each band.
Okay.
So the kind of exposure that we get is really uncomparable to private college, because in private college they have to shell a lot of money to get these surgeries done. So even especially in plastic surgery, wherein even a normal surgery is very expensive outside, many people land up in government hospital, and most of the best part of government hospital is usually the best surgeons there. I have never seen any case being said in Gandhi that this is not operable.
Right.
So we had a technique for all the procedures, and by the time we come to final year, we ourselves start treating the cases just by ourselves, without any supervision. It gives such confidence in your planning, in your decision making. By the time I was out, I was literally doing all the cases without any supervision. So that kind of confidence is difficult when you go to a private setup, because it's a simple fact that people can't shell out so much of money to get these surgeries done, and it's difficult to reach a private hospital.
Right. Any rarest of the rare case that you can share with our audience?
There are many. I can't pinpoint to any one,
Any one for our audience.
There was a case which was, if you see in some people, there is some kind of vascular deformity. On the skin, it looks like another color.
Okay.
Small area which will look like a red spot or something.
Yes.
These are called as hemangiomas. So generally they live only up till this area or whatever it is. If there's a patch, there's extends up till that patch. But there was a case that came to us which showed kind of discoloration to half of the face. Okay, we thought maybe it's up till the half of the face. But when we did CT, MRI and all these things, the hemangioma, the vascular abnormality, almost extended to the inside of the face completely. Around 70% of the face was involved. So what if there's a vascular hemangioma or a malformation? The question is, what if? You need to remove the entire part. So that was a very rare case in our days. No, we didn't remove the entire part, but I think I passed out after that. I don't remember the treatment modality, what they did, but that was a difficult case to see also. It's a very rare case.
Right. Any particular cancer case that you could share with?
Cancers were not very, in the place that I worked, was not majorly for oncoplastic surgery, but there are many centers for oncoplasty wherein, suppose there's a complete tumor and we remove the entire bone, we again replace the whole bone from our leg, there's a free flap transfers, breast removal surgeries, we recreate the whole breast with the tissues available. Cancer surgery is very advanced nowadays. Whatever is the kind of loss that they have, we can literally replace it with like tissues. It's very normal to get back them to normalcy.
Hair, any kind of thing.
Yes.
Okay. Ma'am, like in the, to conclude with any message that you would like to give young girls out there?
Young girls, a lot.
Yeah, please.
See, first, try to keep yourself hale and healthy. There's nobody who can judge your body. If you're healthy and somebody is judging your body, then please rethink about the relationship that you're having with the person. Sure. It's not worth it. And listen to your parents at every stage blindly. At every stage. They're the only ones probably who will wish for your happiness rather than anything else. And the key is to stay happy, not perfect.
Wow. That's quite a statement. The key is to stay happy, not perfect.
Yes, yeah. Definitely.
Thank you so much for this conversation and wonderful insights, ma'am.
I'm honored to be here.
Thank you.
Yes.